بسم الله الرحمن الرحيم.
And a core, right? If you see here, there's a skin covering and a core. This is a fibrovascular core, and this is what we call a papilla. Okay, papilla is something that has a cover and a core. So this is papilloma of the skin. If you just take it around, pass it around you guys, so everyone can have a look at it. So that's squamous papilloma of the skin. Now we know that by definition, a benign tumor is a tumor that is encapsulated, right? But some of them are not. Is a squamous papilloma capsulated? No, it is. Okay, right. Let's go on to the malignant, another benign jar. This is very easy. We have a lot of pictures, a lot of different types of it in the museum. It's from the subcutaneous tissue. Okay, so I have a piece of skin here, a strip of skin, but the rest is fat. Okay, so it's a capsulated tumor. It is lobulated. Okay, greasy to touch, soft in consistency. Okay, that's a lipoma, right? So it's a yellowish tumor. It is capsulated. It is greasy to touch. It is soft in consistency. This is a lipoma of the skin and subcutaneous tissue. All right, so that's my benign tumor, and that's my other one. Let's have a look at these malignant tumors. Let's start with this one. Okay, this is a piece of skin, and what I see here is an ulcer, a huge ulcer. Okay, this ulcer is, when we describe an ulcer, there are several entities that I have to comment on. First of all, the number. When they are only one, this is more with malignant. When they are multiple, it's more that it is an inflammatory condition. So here it is a solitary ulcer. We say the size. Is it a small size or a large size? So single ulcer, it is large size. We describe the edges. The edges of the ulcer are the ends of this ulcer. The very end of this specimen. Do you see this? The very end of the lesion. That's the edge. Okay? Edges could either be everted. Okay? So they are protruding outwards. And how do I know it's everted? If I bring a probe and try to fix it beneath this part, it will go in. Okay? So that's an everted edge. It could be rolled in. Okay? We will see another ulcer that has rolled in edges. Alright? That's also with the malignant. Or it can be punched out. Punched out, that's straight. If it's straight, this is more with inflammatory conditions. So what we fear of are ulcers with everted edges. And if you look here, you will see that you can easily put a probe under this edge of the ulcer. Okay, so this is an everted edge, right? Here, this is an everted edge for the ulcer. So the ulcer here has an everted edge. You can easily put a probe under the edge. Okay, so that's an everted edge. So we say the edges, we said the number, we said the size, we say the floor of the ulcer. The floor is what what I'm seeing here in the ulcer. The floor is what I see here. The floor here is necrotic tissue, okay? So it's necrotic tissue. The floor is covered with necrotic tissue, all right? And finally, what I should do is I touch this ulcer with my hand, okay? If I put my finger there, I feel the base, okay? Usually when they are malignant, because they are infiltrating into the tissues that are underneath, they are indurated. The base is indurated. So to describe an ulcer, the size, the number, the edges, the base, the floor. Okay, let's have a look at this ulcer. This is a small ulcer. This is only half of it. Okay, and if I look here, it's small. That's the size. It's one. It's single. And if I look at the edges, they are rolled in. Okay, these are the rolled in edges. And sometimes we say they are beaded because they are there's thickenings all along the edge. Beaded edges. Okay, so this rolled in and beaded edge is characteristic for which type of ulcer? Which type of tumor? Basal cell carcinoma. Basal cell carcinoma. By the way, this is a squamous cell carcinoma. Okay, most malignant ulcers are squamous cell carcinomas. Okay, or squamous cell carcinoma of the skin. Sarcomas do not cause ulceration at all. Only epithelial tumors are the tumors that cause ulceration. Okay, sarcomas present big and fleshy. Okay, so here we see these rolled in edges. The floor is necrotic and the base is indurated. Okay, this is the basal cell carcinoma. you have to touch. Okay? You have to touch the base to see if it's indurated or not. Okay? Basal cell carcinoma. So we have seen squamous cell carcinoma, we have seen a basal cell carcinoma. Let's have a look at this tumor. We saw it before, do you remember? It's a nodule on the skin and it has an ulceration on the surface. And if we look at the cut section, it is brown in color. So this is a malignant melanoma of the skin. Okay, malignant melanoma of the skin. In the exam, you will only be asked to diagnose, just to identify. Whether it's light or a jar, all that we will ask you for is to diagnose. Okay? So I will bring you like this specimen, and you say what's the diagnosis. You say lipoma subcutaneous tissue. If I bring you this specimen, you will say it's a basal cell carcinoma of the skin. Okay? Etc. etc. Right. Let's go and look at the museum, because they're going to close it in like 15 minutes, and then we will come back and look at the new slides for today.
Okay.
And we revise, and I'm with you until you